Everyone, good morning. I want to thank everyone for being here. We know that the COVID-19 situation has been with us for a while. And I know from my perspective at the beginning, I think we were all scrambling to get information out and figure out what needed to be known and all this stuff. And as time has gone on, I've gotten a little more comfortable that, that we know, the community knows better kind of what's going on, what needs to be done. But I think maybe not necessarily. So we thought it might be useful to convene some of the leadership in the city of Seaside to make sure that you know what resources are available to you from the county that you can make available to your constituents. So there's a lot of information, there are a lot of things going on, and it's a lot to keep up with. So we wanted to give you this, this briefing, and we're also going to be recording this so that if you want to check back in on it later on some of the information, or you are talking to someone who could use the information, you can let them know that this is available. Wendy, is this going to be available through my webpage and my YouTube account?
I was thinking we would just share it with anyone who needed it. I wasn't thinking sort of public, but whatever you want to do, we can do.
Okay. Well, we can maybe if people have thoughts about the best way to make this information available, please use the chat. Also, please use the chat to put in any questions that you may have that you hope the participants from the county can answer, or that we can answer for you either during the presentation or after. So what I'm going to do is see if I can introduce the community leaders who are here. We do have a list of the county presenters, so those, and you'll be hearing from them as time goes on. And I just want to again ask all of you to make sure that if you do have questions or comments, that you use the chat so that we can get as much of the information that you want and need to you during this hour. So I'm just going to go down my list. After I introduce the community folks who are here, I am going to ask Mayor Oglesby to welcome people also on behalf of the city of Seaside. So I see that Mayor Carbone is here. Thank you, from the city of Sand City. Appreciate you being here. Alana Miles from the Monterey Peninsula Unified School District. And maybe Ms. Miles is the chair this year of that board. I'm not sure. Alyssa Kaspersky is here from the City Council of the City of Seaside. Dan Mewis, I think, is from the City of Seaside as well. Jason Campbell is on the City Council. He's here. John Wizard on the City Council of Seaside. Thank you for being here. Mayor Allison Kerr from the City of Delray Oaks is here. Really appreciate you being here as well. Let's scroll down here. Superintendent P.K. Diffenbaugh from Monterey Peninsula Unified School District is here. Appreciate you being here and all the work that you and your folks are doing. Those are the people that I see so far. And so we'll go ahead and ask Mayor Oglesby to also do a brief welcome, and then I will start us through the agenda of presentations from the county staff.
Well, thank you, Madam Supervisor. I just want to say welcome to everyone, and thank you and your team for putting this briefing together. Appreciate everybody being on the line, and look forward to hearing from your team and the county personnel. But I want to be clear about your leadership, and thank you for doing this and all the work you do for us here in the city of Seaside. So thank you.
Thank you, Mr. Mayor. I am going to start our agenda with some information from the state and our local metrics. I do want to just remind all of the county presenters to please, as you're talking, if you can let people know where the information that you're talking about is being provided publicly, where they can find it. And if there are mailing lists or distribution lists that anyone wants to be added to, what those are and how to do that. And of course, again, any of our participants, if the information is triggering a question, please put that in the chat because we have a pretty packed agenda and I'm not sure how much time we'll have at the end for actual questions. So thank you. With that, we're going to start with Dr. Moreno, who's our public health officer for the county, and Kristy Michie, who is the keeper of all data and manages to be incredibly calm through, I don't know, everything. So take it away, Dr. Moreno and Ms. Michie.
Yeah, sure. Thank you, Supervisor Parker, and glad to be able to join all of you today. So yeah, so Ed Moreno, I'm the, excuse me one moment. Okay, Ed Moreno, I'm the health officer for Monterey County, Director of Public Health, and I am going to share my screen and provide a presentation that Charles has seen maybe 3 times already, but it's the most recent, I think, and the most concise and most useful presentation that we've got, and it's what we're using this week, and it's been received well. So go ahead and share it with you now. Okay, let's see. All right. So hopefully you can see. Oh, I need a little work here. Hold on.
And Dr. Moreno, while you're getting situated, I do want to thank all of the county personnel for being here and just ask that if you can keep your presentations to about 5 minutes, that will help us hear from everyone in the hour that we have. Thank you.
Absolutely. Okay. So this first slide, are you seeing the full slide, full screen? Okay, thank you.
Yes.
All right. So this is the number of cases that we have in Monterey County. Early on in our experience with the pandemic, you see down here, we were able to really slow down the transmission. Then we aligned with the state for reopening businesses, and we see that the number of cases increased and then leveled off. The green part of the bars is the number of hospitalizations each week. But over the last 5 weeks, we have seen a reduction in cases in Monterey County. So that is a good sign. We do have a decrease in testing rates in Monterey County and testing rates across the state. But as you'll see in a moment, I think that would only partly explain why we have a decrease in cases in Monterey County. This is a slide that shows the hospital bed census for COVID. In other words, on any given day, how many people in Monterey County are hospitalized because of COVID-19 or with COVID-19. And again, early on in the pandemic, there was a steady, slow rise in hospitalizations, but as more people got out to work again, to provide services, to go seek services, we had more transmission, and the hospital census for COVID-19 rose and stayed steady for several weeks. We do see a decrease in hospitalizations, and I think that coincides with or supports the our suspicion that transmission has slowed down again a little bit. So decreased case rates and decreased hospitalizations would support that. So I'm hoping that we're correct in that, because that's really what we're trying to achieve all along, just trying to do our best to slow the transmission of this virus. This is a slide showing ICU bed, intensive care unit bed availability. It's different than a bed census. It basically is how many beds do you have left to take care of really sick people in Monterey County. So for quite some time, we had this shows that we had 70% of our beds, our ICU beds in our hospitals were available should we need them. And then we started filling up ICU beds in July and August. And we got down to about 10 or 20% of our beds left. We were really concerned that That might be the beginning of what a few counties in California experienced, which is they basically filled up all their beds and started shipping people, residents out of their county to neighboring counties for hospitals, intensive care. But we bounced back, and patients in the ICU are being discharged, and we're not filling up the beds as quickly. So we got about half of our ICU beds available again, should we need them. So that's also better news. And then this is a map of the Monterey County testing rates. Testing rates are down across Monterey County and the state, which is what percentage of the population is being tested. And so not only do we have a decrease in testing rates, we also have differences from region to region in our county for testing rates. So the red regions here represent those parts of the county where fewer people are getting tested per capita. And it moves through orange, yellow, and finally green, green being the those parts of our county where the greatest number of residents are being tested. So what we would like to do is to try to narrow this, the difference between across the county. If there are parts of the county where fewer people being tested, especially if they should be tested because they're symptomatic or they've been exposed and become symptomatic. For example, we're still looking at trying to implement strategies to get more testing availability to those parts of the county. And here, Supervisor Parker, we have the two lines on this graph. There's a blue line and an orange line with the dots. The blue line represents our case rate, and our case rate, as I mentioned, has been going down. And as of Tuesday, and this is as calculated by the California Department of Public Health, it's not our calculation, but we're using the same data for our calculations, their calculations. But based on their formula, we have a case rate that's adjusted to 13.9. It's below this yellow line, which is 14. And now that it's below that level of 14, that's a state threshold. Any county whose case rate is below 14 can accept and consider waiver requests from the schools to reinstate in-person instruction in the classrooms. So I expect we're going to be receiving this week applications from a few schools who want to bring the kids back into the classroom for in-person instruction. However, the case rate of 13.9 must dip below a case rate of here, 7.0, this red line, in order for the entire county to move into the next tier, tier 2, where businesses can resume, many businesses that are restricted to outdoor services can resume indoor services. And this next curve, the positivity rate, that rate represents the percentage of all tests for COVID that have a positive result. That positivity rate is decreasing, which also is can be a marker for decreased transmission, which is a good thing. We're still having an impact on this pandemic virus by all the measures that we're taking and slowing it down. So positivity rate is decreasing, but that also has to decrease to this level of 8 in order for the county to move to tier 2. And so I'll just end, Supervisor, with a reminder of the steps that are effective in reducing, that will help us reduce the case rate and positivity rate. So we do, in order to reduce the case rate and positivity rate, which will get us to tier 2, we have to continue to reduce transmission. And to reduce the transmission, these are the things that we must continue to do. If we become complacent and lax in our efforts to reduce the transmission, our case rates will level off and could potentially go up again. So we don't want that to happen. We also, these are things that you've seen before. So Supervisor Parker asked me to keep it brief. I'll let you read it. I'll keep it there for a little bit. But just also, it's really important that our community members pick up the phone and stay on the line when our case investigators call to tell them that they're positive, and the patients probably already know they're positive, but confirm that they're positive and instruct them why it's so important to isolate themselves and not infect other people. That's the purpose, again, is to reduce viral transmission. If we can reduce transmission, we can reduce our case rate and our positivity rate. And if we're effective at that, we get to move into tier 2. So I'll end there, and Kristy Michie is on the line. If there are any questions, we can answer. Supervisor.
Thank you, Dr. Moreno. Appreciate this information, and the fact that our case rate got below the 14% line does mean that schools can apply for waivers and could possibly go back to some in-person instruction. There's a whole process for that the schools are aware of, but it's kind of the first step of some good news in terms of the disease transmission. One question I would have, Dr. Moreno, is say we continue the trend and we're able to get the lines to go below the lines they need to be below. What happens if by reopening again, disease transmission rates go up? Do we know how long? Anyway, what happens then?
So certainly, so whether we're opening up businesses in tier 2 or we're opening up some schools with waivers, we're bringing more people together that previously haven't been coming together in previous months, which can introduce the likelihood of transmission. So when that happens, these recommendations are still very important. So if you got kids coming together, you got teachers showing up to school again, it's really, really important that they still use face coverings as per guidance and follow these other prevention measures. As far as schools, there's a certain set of criteria for allowing schools to resume in-person instruction, but there's a separate, different set of criteria for closing schools or closing classrooms and then closing schools. So there are different set of criteria that I don't know that we have time to go through at this point, but it's been laid out. It's been laid out in a separate guidance document from the CDPH. So bumping back in above 14, if a school is open and we bump up above 14, or if you're in red tier 2 and then we bump back up to tier 1 and schools are in session, they don't automatically have to shut schools to go back to distance learning. There's certain criteria that we would need to follow.
Thank you. And there are two questions here. One is, are we still under the shelter-in-place order?
We're under the, yes, so I have a health officer order that's still in place that aligns our county with the state executive orders and state health officer orders. So the answer is yes.
And then the other question does have to do with the waivers. Would the school waivers be for certain groups like foster kids and English learners, or would the waiver be more widespread than that?
So there's a separate guidance out from the California Department of Public Health for cohorts, and those cohorts are allow kids to come together in organized settings with adults supervision. And so that's one. I'm sorry, can you repeat the question again?
Yes. Are the school waivers that now schools can apply for, are they for certain groups, like foster kids or English language learners, or is the waiver broader than that?
Okay, so thanks. So the cohorts guidance is for specific groups. And that's for someone, there are a group of kids who need a special ed, who need assistance for learning disabilities, therapy, for example.
And that's in place now, right?
That's available now, and some schools are implementing that now. So that's for that type of design for that type of student subset of student population. The waivers are for the entire school, which means that if the school submits a waiver and they can demonstrate that they have addressed all the requirements that the state requires for school students to come back into the classroom and resume classes, then they can go ahead and do so. And it's for all students. There is an option for parents and teachers to identify students that would be could be harmed by coming back into the classroom. So if you have some students that have certain medical conditions, if they have certain like congenital immune deficiency conditions and they're susceptible to viral infections, bacterial, for example, that student could remain in distance learning while the rest of the class is in the classroom. But definitely the waivers are intended for the entire class to come back.
Thank you. And I know there will probably be, as this happens, there will be more questions. So Dr. Moreno, could you just let people know if they have further questions, what's the best way to ask them and get them answered? Is there an email to you? Is there a hotline number?
So yes, Supervisor. So there's our website. And so our website is mtyhd.org. And that will, you can access a lot of different information about COVID-19 and different phone numbers there. But we still have our information line for COVID-19. Kristy, what is that number?
831-769-8700. And I'll put both of these in the chat box.
Yeah, thank you, Kristy.
Great, thank you. Obviously, a very important situation and set of information, but let's move now to our next county presenter. Thank you, Dr. Moreno. I think you and Kristy Michie are on the agenda a little bit later as well. The county recently developed a disparate impact report, and Rosemary Soto is going to be talking about that. And this is of particular interest, I think, to me and to the city of Seaside, because as we have seen, the city of Seaside has a higher rate of COVID-19 positive cases. And I think a lot of that is due to the fact that a lot of essential workers live in Seaside. And it's also a community where there have been disparate health outcomes and maybe some issues of healthcare access. So Rosemary, could you let people know what that report shows?
Hi, good morning, Supervisor. Thank you for the invitation to be here and share about this report that was put together with the support of it was actually a team effort with many of our departments that under the leadership of our CAO, Charles McKee, and our assistant CAO, Mr. Nick Chulos, directed us to work on this report. And what I'd like to share is, I see the links are in the chat box, so if you'd like to read the report, it's not too much of a read. I think it's something that you can skim through and really take some of the most important parts of it. And I think one of the things I want to start with is just to share out that the report and the strategies that you'll see in this report align very well with our initiative that focuses on governing for racial equity. It really identifies where are the inequities and the gaps within our communities and what has perpetuated and created really a ground that created many of the issues that caused such a disparate impact as a result of the pandemic, which I think that many of the things, it's safe to say that we had known of many of these disparities and these inequities, but the pandemic and the way that it impacted our community really highlighted where they are and what needs to be done to be able to address those. So many of the communities were dealing with a lot of issues in regards to health and health access. So we have short-term and long-term strategies that our partners in health have identified that can and should be done in order to address those gaps, as well as in public assistance, meeting the basic needs of our communities. Many of our community members are not accessing the public assistance programs that are available to them. So our Department of Social Services, in partnership with many of our community-based organizations, are looking at what are those strategies that they can implement. Many of our are underway, but at the same time, there's some expansion and some areas for improvement that they've identified. In terms of housing being a critical matter that has been longstanding within our county, we've looked at what are the ways in which policies can change to better address the need for building more affordable housing. And our departments in the Resource Management Agency and Environmental Health are also working on strategies that are both long-term and short-term to look at how can we address the issues around housing needs. our homelessness and housing instability areas that have clearly come to the forefront as well. Our partners have looked at different strategies that can address the current issues that have been facing our community in terms of homelessness, and those who are at the brink of homelessness due to the instability that they face. Our economic development team was also looking at some of the ways in which they can address the wage gaps and the increasing of costs, so just cost of living, and then the depletion of savings that are really a big cause for that financial instability for many working families, and have clearly contributed to the disparate impacts from COVID. We also looked at how do we address those inequities, and that is looking at how our workforce development and entrepreneurship programs are implemented and how they can be expanded, looking at what are the grant funds that can be available for allocation to address wage losses, small business loss, or create funds for those immediate no interest loans, as well as looking at what are those classification of frontline workers that can happen to deem them as essential workers, and that would be to receive that county level and state level support for other areas, especially items such as childcare, benefits around that would help address the gaps that they have. Our criminal justice system partners also have been working diligently to address those that are involved in the justice system, including the incarcerated population. The state had issued a no bail schedule, and that is something that expired, but our own local county officials implemented our own version of the same, and really helped to address the jail population, and further looking at how do we best protect those that are working in the jail as well as those who are housed in the jail. So that emergency bail still stands, and our public defender and district attorney's office have continued to work together to resolve cases earlier and remove individuals from custody. Our legislative advocacy program has a huge part in this report, and looking at what are those changes in legislation that need to happen, and help guide our board of supervisors with making decisions about which steps they need to take in terms of advocacy for legislation and policy change. And some of those can be done locally, and many are state and federal. So those are areas that our legislative team is focused on. A part of this report that I am especially feeling as though it's one of the most critical is the community engagement piece. This report is something that I consider to be a living, breathing document, and should and could continue to evolve and change as we move forward into the next coming months, and possibly even a couple of years, however long this impact will be in existence in our communities, and until we can fully address all of the underlying conditions that we've clearly identified and the inequities that we've so long discussed. There is opportunity that we are continuing to expand to engage community groups. To date, we have engaged a few community groups based out of Salinas, North and South Monterey County, and clearly we have definitely the desire and intent to expand our community engagement to groups and community individuals out in the peninsula as well. So community engagement, when I say that, I'm talking about continuous conversations, diving deeper. I'm giving you a very brief overview of what this report contains, but we want to also have some meaningful conversations where community voice is providing influence into how this report continues to grow and how the initiatives, the strategies continue to be implemented. And it would be continuous. So that means that we would stay together in this work and continue to have conversations over time. So thank you.
Thank you, Ms. Soto. Really appreciate you in a very brief period of time covering it's a pretty thorough report. And as you say, the work is ongoing because the impacts are significant. And I wanted to ask if there are people on this in this meeting or who may have an interest in participating in these ongoing community conversations. If they have a particular interest in these you know, the inequities that we see, how would they get involved? What's the contact? Where can they learn more?
They can reach out to me. I'll put my information in the chat box, and I'd be happy to connect with anybody who's interested.
That's great. Thank you. Thank you. Yes, there's a lot of work to be done in this area. So thank you for being here. And I think, you know, Seaside is a very engaged community on these kinds of issues. So their participation will be really valuable, I think. We're going to move now to some of the COVID-19 data that is specific to the city of Seaside, what the testing rates are, the positivity rates, and any sense for where exposure may be happening. And that's our public health team. So I don't know if it's going to be Dr. Moreno or Ms. Michie who takes the lead on this, but this is yours.
Okay, thank you, Supervisor. I'll get started, and Kristy can add if I leave things out. So I'm going to share my screen again, folks. Okay, so let's see. So this is, go to the top. This is our county website, and you can get there by using the mtyhd.org and click the link for data, and you'll get a summary of data at the top. And there's, some of you hopefully have already looked at this. I'm going to jump down to, I think the question, Supervisor, or the issue or concern was the how are things going on in the Seaside area on the coast.
Right.
So I'm going to jump down to, let's see, something that should look a little familiar. This is the testing rates that I already shared with you. But I want to get down to this area because this is where we have data by region. And you need to scroll just a little bit here, but this area here is the Peninsula Big Sur area, which includes Seaside and other neighboring communities. And what you can see here is a number of cases here. And so, oops, it's not being very clear. Sorry, I'm going to go here. So the if you hover over with your cursor, you can get a little bit more information. But this is showing that the 93955 zip code has had the highest number of cases in this region. And by the way, these four regions, Kristy Michie has decided to divide up the county into these regions, but we consistently use this breakdown, not just for COVID-19, but for other reasons as well. So you can see this is the information that you can look at and see how many cases are in each of the zip codes in not just the Peninsula and Big Sur area, but the other parts of the county. Then I want to share this. So this is, those are numbers, Supervisor, those are the numbers. These are rates. So this is taking those numbers and dividing it by the population to determine rates. And that's how we can compare one area to another. So these are zip codes, they're large areas, but they are still useful. And so what Kristy's done is she's looked at all the zip codes and calculated all the rates. And then she ranked them lowest to highest. And then she took 25%, the lowest 25% of rates, or the zip codes with the lowest rates, that's one quartile, the next, until you get four equal quartiles. And so, and then she looked at in those, like, we'll go right here, the lowest rates, case rate right there, 0 to 66.5 per 100,000. She looked at those and said, okay, this is 25% of the case rates, and it ends at 66.5. The next group, 66.86 and up. And so that's how we developed those four different groups. And so the question today for discussion is, how are things going over here along the coast? So as far as the best rates, we're seeing that down in the further down the coast. There are lower rates of COVID-19, And then as we move it to the Monterey and Seaside area, the rates start to go up. You can see yellow here in parts of Monterey, the rates are starting to go up. And then when we get into Seaside, and particularly the 93955 zip code, you can see that the rate is in this range. So it's the third quartile, not the worst, but it is in the third quartile. And then the highest rates are over here in the East Salinas area. And as we go down into through the South County cities, we see the highest case rates. So this is the data we have. And the question is, what does it mean? What do we do about it? That's usually, why we collect data, because we want to know so that we can describe if there's a problem, describe the problem, and then decide whether we can solve the problem. So we definitely do have higher rates in this particular area. And what we've been trying to do in the health department, we've been trying to recognize that there seems to be higher rates, trying to outreach into these communities here and also South County and East Salinas to try to do what we can to inform the public of the importance of the prevention measures that I just mentioned earlier in your hour, but also if people have symptoms that they should seek medical care or get tested so that they can confirm if they have COVID or not. And if they do, then they can isolate and prevent spreading it while they're infectious. And so we've also, in order to improve access to the testing, we have also had an agreement with VNA, Visiting Nurses Association, to try to get out there and make testing more accessible. We have also had, we didn't have anything to do with it, Supervisor, but we did, I did participate in some of the planning meetings with Planned Parenthood Marmonte to get out to the college there and again, make testing more accessible. I just want to point out that more testing doesn't in itself reduce case rates or reduce positivity rates. It's what happens with a test result. If someone tests positive, and working with their healthcare provider and working with public health, if we can get these people isolated and we can reduce the spread, the transmission of the virus, that is what helps to reduce our case rate, which gets our businesses into tier 2 eventually, where they can start resuming more business activities indoors, and other restrictions would be relaxed as well. Supervisor.
Thank you. And speaking of testing, I know when you look at so this is the case rate map, and then when you look at where the testing is happening at a greater rate, you see that the Salinas Valley has been getting tested at a high rate, so they can kind of keep tabs on their transmission, but that in Seaside, where there's kind of a higher rate, they haven't been being tested at quite such a high rate. So that's one of the reasons the testing conversation is important. If you don't know, if you don't have symptoms and you don't know that you have COVID-19, it's more likely that you're going to be spreading the disease to others, because you might not be taking the precautions at home or elsewhere. So in Seaside, I see a note in the chat that Planned Parenthood Marmonte has been providing testing at Monterey Peninsula College, which has been really, I think, the only testing on the peninsula where you could just show up and get tested. If you want to get tested at community hospital, you have to have symptoms, and it's a whole another deal. And so while I'm on the subject of that testing site at MPC, I want to acknowledge that David Martin from MPC, who's the superintendent president, and Rosalind Green, who sits on that board, have joined the meeting as well. And we really appreciate the partnership with MPC. And it sounds like there are discussions in the works to have the Planned Parenthood testing site moved actually to Seaside, which would be great. And other testing locations, if people are clients or they have a family member who's a client of the Seaside Health Clinic. There's testing available there. I think the hours are somewhat limited, but it is possible, so people can check there. And then Dr. Moreno or Ms. Michie, do you know where the VNA has been doing its testing, and are they still in Seaside?
The VNA currently, the combined clinics with the VNA and that the hospital support too, have been in this far South County for the last few weeks. They've been testing in the San Ardo region, I believe. I don't think that we have set a location for the next round of testing, but we'll be sure to get that out on our website and through our PIOs to get that information to you as soon as it's available.
Great.
Supervisor Parker?
Yes.
I believe that doctors on duty on Lighthouse, I think, is collecting specimens. So there are some other providers in the area. I just want, if you don't mind, just make one point, and that is we understand that there are some times when a person needs to get tested and they can't really afford to make an appointment with their provider, and they need to get tested right away because they've been exposed, for example. But we do want to still encourage people who have providers like at Seaside Family Health Center, or someone that pretty much utilizes doctors on duty as their main source of care, that the added benefit of consulting with your healthcare provider is that you get the medical advice. OptumServe doesn't provide medical advice. VNA really isn't functioning as the healthcare provider, but our doctors and staff at the various clinics that are collecting specimens will provide the medical advice that people still need because they're sick, and they can be the first. That could be the first opportunity for a healthcare provider to provide guidance on isolation and identifying people that they may have exposed. So there's a tremendous benefit to going to a healthcare provider or consult with your healthcare provider if you have symptoms of COVID.
Thank you. Good point. And it's a nice segue into contact tracing. So could you talk about how that is going and how the city can help support the effectiveness of that work?
Yeah, sure. I could, but I think Kristy's got a video on, and so I'll let her, because she's also been really instrumental in our Public Health Bureau in the hiring process, working with our HR department to bring more people on board to do this important work. So please, Kristy.
So I could talk a very long time about case investigation and contact tracing, so I'll try to make it as brief as I can. I do want to assure you that this is not a new phenomenon. Our public health department and public health departments across the nation have been doing case investigations and contact tracing for over 20 years. And so we had a very small team at the start of this. Way back at the beginning of the year, we utilized our existing staff, which is a whole 3 public health nurses that we had at that time, to start and launch our case investigation and contact tracing program. Over the course of these last 9 months, because we did start out in January with excuse me, monitoring travelers and then moved into actual cases. We added on staff as we grew. As our case numbers grew, our teams grew. And our strategy was, of course, to utilize the public health teams that had the most experience first. So our communicable disease team was first. And then we folded in our TB case and contact investigators. And then we moved out to our maternal and child health, public health nurses, our whole person care team, our chronic disease health education specialists. And so we brought in sequentially these teams. And finally, we got to the point where we had exhausted the entire public health staff and have been recruiting now for temporary help. And that has those recruitments have been up on our website, and we've been very successful in building those teams. Right now, currently, we have about 100 case and contact investigators trained and available for this work. About half are bilingual in English and Spanish. The basic process is that we receive reports from medical providers and the laboratories. A lot of times they don't have contact information on them, so we have to work with those providers to make sure that we know how to get a hold of these people. We have a phone number that actually works. The case investigator then calls the individual, provides them with basic health information, sometimes discloses their diagnosis. They're not aware yet, that provider hasn't been able to get a hold of them, gives them, health information, talks to them about where they might have gotten sick, who they've been around, have they been around people who were sick, where do they work, and then also who they might be giving the virus to that they've been in contact with. So they do that's called essentially contact elicitation. So they get a list of the contacts that the person has been around and their contact information as well. They provide information about how long to stay home, what you need to do to go back to work. And then those contacts are passed off to our contact tracing team. And those individuals are then the ones who are responsible for contacting the contacts of the case. And so they make those phone calls, give them health education, see if they're symptomatic, try to link them with screening services or other supportive services. So that's the basic process for case and contact investigations. We're currently quite busy. We've elicited to date over 21,000 contacts, and currently on our caseload have almost 2,000 individuals that we're actively monitoring that are cases, and probably another 2,000 contacts. So a lot of people have been reached by our case and contact investigators, but really what we could use help with is encouraging people to answer that phone call. So, some people may be a little bit reluctant. They don't recognize the phone number coming up. They don't answer the phone, but it's really important that we can help them provide education. And also in some cases, if they can't safely isolate at home, we can get them linked into an alternate housing program while they're infectious so they can protect their family members who may not have been or may not be sick yet. So there's a lot of support that we can provide people as well. And encouraging your constituents to answer the phone and participate in those discussions is really important.
Thank you very much for that. And yeah, it's the testing is important, but the reason that we do it is so that people know the precautions to take. And that whole question of if you do find that you are positive for COVID and you don't have a way to safely or effectively quarantine yourself or isolate yourself at home. Many people live obviously with family members or in multi-family situations within the same dwelling. And so this is a nice segue to Kelsey Scanlon, who can talk a little bit more about the emergency operations and some of the resources that the county has been able to make available to the community. We do have opportunities for people who are vulnerable homeless, as well as people who live in situations where they can't isolate. And the emergency operations, along with the public health department, have just expanded their ability to do the work that they always do, but find new and better ways to be tailoring what they do to this particular threat to the health of our communities. So Ms. Scanlon, take it away.
Yeah, thanks so much for having me. So the Emergency Operations Center is essentially responsible for managing responses to all types of hazards, which include pandemics. We support the health department as this is a primarily health specific incident. And at the beginning, they had identified a need to provide housing for individuals who, for whatever reason, could not isolate safely or quarantine safely, if you will. And so the program started out as what is commonly known as Project Room Key back in April and has expanded into a variety of different avenues. Primarily, we offer at this time housing for individuals who have either tested positive for COVID-19 or is a person under investigation, and they either live in extremely congested housing they don't have any housing at all, or for whatever reason are unable to safely isolate at their homes. We've seen people illegally be evicted because they are COVID positive. We've seen people locked out of their homes by their spouse. It's just, you really never know. I know that's a tough relationship, but you really just never know why it is that somebody can't isolate safely. So all of the conventional reasoning that we came up with at the beginning, we soon into the emergency realized was not necessarily the most useful. So our team is able to flexibly adapt to the individual's need. We have housing identified in hotels and at-large facilities across the operational area to serve every community that may be impacted. And we try to place people as close to their place of residence or origin as possible. So we're not sending somebody from King City to the city of Monterey and vice versa. And so we have a very standard operating hours, if you will. It's Monday through Sunday. 11 a.m. to 7 p.m. is when we accept referrals. Those hours sound really odd, but surprisingly, we find that we get more referrals in the late afternoon to early evening. At this point, people can be referred to our housing program either through their case manager at the health department, which is why they need to answer the phone. So if they want to be connected to housing, they need to be involved in the contact tracing process. Or they can do so through their primary care physician or through a hospital. And all of those individuals know how to get in touch with the EOC. And so we don't take direct referrals from the public. They have to be affiliated with an actual test or through a licensed medical professional. And we don't take walk-ins, which is why we don't advertise the locations of the facilities to the public. So we've already seen a lot of people try to scam the system to get free housing, even though they weren't COVID positive, or they tried to stick around longer than their isolation was anticipated. And so ultimately what we try to do, instead of just sending somebody back out if they don't have any resources, is to try to connect them through social services to more permanent housing if it's available. And we've been able to successfully connect several COVID positive families as well as high risk homeless individuals with more long-term stable housing, which is it's really surprising to me. Honestly, I didn't think that we would be able to solve some homeless issues in the middle of a global health crisis, but surprisingly that has been a fortuitous outcome, if you will. But those services are available to you, and I will defer to Maya Carroll to talk about public information, specifically the daily situation report.
Fantastic. Thank you so much, Kelsey. It really has been impressive, the flexibility and the ability to, connect people with what they need. And I was just going to ask you if people wanted to receive the daily situational report that has the information about some of these housing options, how they would do that. So in order to get that information, I'll move now to Maya Carroll and Karen Smith, who can talk about the public outreach in terms of the media briefings and ways for the public to get information. And then we'll move to some of the public, the PSAs that we have developed and messaging and flyers that are available to you all through TMD contract that we have with a public marketing team. I also, just as we move to Maya Carroll and Karen Smith, for public information, I do want to just acknowledge that Craig Malin has joined us quite a while ago in this meeting. He's the city manager of the city of Seaside, and then a couple of community leaders from the area, Kay Klein from Seaside and Lisa Griffin Burns. We just want to thank you for being with us as well. All right, Maya or Karen, whoever's taking the lead on this, it's yours.
We're going to start with me. This is Karen Smith. And since it's a health a health issue. Oop, back. Wow, I'm just so impressive today. So we've actually been talking about COVID at the health department since December, when there were reports of an unknown virus in China. For those of us who work in public health, when that happens, we take a collective deep breath and pray that this isn't the one. So we actually launched our page that had the disease information back in January. However, if you go to Monterey County COVID-19.com now, you'll find everything from the current case count to what to do if you're sick, what's happening with orders, what schools can do. There's just a plethora of information. There is also a dedicated page for businesses that include a toolbox. And let's see if I can go there. It's thinking. Nope. Wow. That's not it. Okay, so there is from the Herald. Here's the business page, and everything is on there that you might possibly need, what to do in case of exposures in the workplace, the self-attestation form for those who are coming back to work, and if they can't get a docs note, they can say themselves that I've been under care, I've done my quarantine, or I've done my isolation, and I'm ready to return for work. And then just some various information about, I've tested positive, what should I do? I've got people who test positive. Also, we've talked about our hotline, 769-8700. And the people who answer the phones are also available to ask, answer questions about businesses, what kind of guidance. If they can't answer it, they'll find somebody who can. Often that's me, and people are welcome to email or call me and find out, and I can try and help them with their problems. And then I think importantly, one of the things we don't think about necessarily, but we have our Behavioral Health Bureau, who has been offering Zoom support groups, for lack of a better term, and has some resources that might be useful for your people. I know that it's particularly getting tough for a lot of your constituents who maybe have been closed down, maybe have their kids at home, and they're trying to work and manage and balance school and all that. There's some information on that link, and I'll provide these slides to anybody who's interested. I'll post them on the website. And then, of course, we also do health alerts for urgent healthcare provider information. So healthcare providers get specific information about when testing, things change about testing, when we start having issues with when we finally get the vaccine, what to look for, asking them to provide letters, etc. And then one of the other things we have that's very active is this is a snapshot of not all of our social media at the health department, only our Facebook and Twitter, and not even all of those. But you can find information and have people share information. And one of the things I would ask that would help us immensely is to put out the message that one of the things people can do is to not forward and not spread misinformation. They might not know it's misinformation, but for people to be very wary about what they share and to make sure that it's from a reputable source. And we're a reputable source. So we have a main Facebook page in English and one in Spanish. EMS has their own. Environmental Health has their own, which has some specific things to clean up and restaurants. Monterey County Collaborates is a collaborative that mostly deals with tobacco and that sort of thing, but they're out there sharing messages about it. And then we have a couple of big programs. And then on Twitter, primarily we have a main page, a main health department page, and a Spanish page. And now I'm going to turn it over to Maya.
Hi, good morning, everyone. I'll go through this quickly because I know we still have some other presenters. And it's the county administrative office. I know that, and hopefully Karen will change that too when she sends it around to everyone. That's what happens when emails cross in the morning. Sorry, Charles. We'll get your job title right. I'm just going to quickly run down some of the communication options that we also offer. We have a COVID-19 email account. It's like the hotline, except through email. Questions that come in, if we don't have the answer, we can get it for you. And we do try to respond as quickly as possible to those emails. We do get a lot of them, so we try to get a response for people within a couple of days. Our county homepage has a lot of links to key COVID information and resources, and our website address is there. We have social media accounts on Facebook and Twitter, which are packed full of information for people that they can share. We do media briefings, which generally focus on the county's COVID-19 response. They are Mondays and Fridays at noon, and they stream on our YouTube channel. Most recently, we have added fire information into our briefings. Hopefully people have enjoyed hearing about that, but I think once if the fires are ever out, we can get back strictly to COVID. We also have some video resources for people who may have social media or other video platforms they'd like to share. We have some Spanish language public service announcements that are available to download and share. And we also have a COVID-19 community newsletter that comes out weekly, and you can join by opting into the daily situation report or emailing to me directly. And then Jane, you mentioned earlier the daily situation report, and here is that information. You can sign up for the daily situation report, which is loaded with COVID data and links to charts and other information online. You can also text MC COVID-19 to 888-777 and receive text alerts about COVID issues. And that'll do it for me, and I'll leave some time for the rest of our speakers.
Thank you both very much, and really appreciate all the work that's gone into making sure that there is accurate information available through the county as a trusted source. And so I do want to turn to Nick Pasculi and Nick Chulos, who are the Nick team in the nick of time, doing a lot of messaging and making resources available. And so I'll turn it over to the two of you. And just before I do, I want to just say that I noticed that Pastor Kenneth Murray is here. Welcome, welcome. You snuck in and I didn't see you. So want to say hello to you now. Take it away, the Nicks.
Thank you, Supervisor Parker. If I could just give a quick introduction here. I know we're getting tight on time. For the benefit of the group, back in late April, early May, the Board of Supervisors really realized the need for a more aggressive and outward-facing public messaging campaign regarding the COVID pandemic. And so at the direction of the board, we solicited and eventually hired the firm of TMD Creative from Salinas to do the outward-facing messaging for us. It's currently funded with CARES Act funding. This is a very aggressive messaging campaign. We've covered everything from proper health protocols to public gatherings, testing messages. Everything is done in English and Spanish. There's a weekly planning meeting with the chair of the Board of Supervisors, with Nick Pasculi from TMD, Charles McKee, the county administrator, the health director, Elsa Jimenez, Dr. Moreno, Kristy Michie, Karen Smith, and Maya Carroll, and myself, where we evolve, because this is an evolving messaging campaign, we're constantly fine-tuning the message, and we cover everything from TV, print, social media, billboards, radio. Some of them are PSAs, that are free. Some of them, a lot of it is paid content. We've coordinated extensively with the Convention and Visitors Bureau, really all the major local industry associations, the cities, the Office of Education, and everything that we've created or that Nick's firm has created is placed in a Dropbox file that's shared. It's available to anyone. We've sent that to the city managers, to the trade associations, the schools. So that's kind of the introduction. We are committed to continuing a very aggressive and evolving public messaging campaign as this pandemic continues to evolve. So Nick Pasculi, with that introduction, would you like to comment?
Sure. I want to invite everybody, if you don't have or haven't received an invitation to the Dropbox, if you email me directly, I put my email in the chat earlier today, and Supervisor Parker and Wendy have my email address as well. So feel free to reach out to us through email. I'm going to share my screen just briefly, just so that you all can see and get a feel for what's in the Dropbox. So since June 1st, we have developed well over 100 assets and tools for the use of the county. And as Nick Chulos mentioned, we are reaching the county in every possible corner in every possible way. So we've developed some business resources. We've developed a very strong digital campaign where we're targeting people in specific geographic areas, specific zip codes, and specific locations with messaging. We have some generic business resources so people can make their own signs. We've developed a whole series of iconography that support the wearing of face coverings, that support social distancing, not making trips. If you're sick, stay home. Our outdoor campaign includes 8 billboards. We do have one in the city of Seaside. That'll be up through the end of the year. There are very, very few billboards on the Monterey Peninsula, and we were just lucky that somebody canceled a contract with the one in Seaside and we're able to get up there. And the other 7 are scattered throughout the county as far down as King City and a couple in Salinas. We're also on MST buses. We are on 15 MST buses, and those are on a random route. So they are literally seen throughout the county and possibly even into Watsonville, Pajaro, the areas that sometimes get forgotten about. And then we've been doing a print campaign in the Weekly and in Herald and in South County newspapers. We are trying to reach a multitude of audiences. We're trying to reach visitors, as you all know, especially those of you on the Peninsula and Seaside, that we get visitors are a very important target audience for us to reach out to, and we want them to be respectful and mindful that we are trying to curb this virus when they're here visiting. So we did a campaign directed at visitors. We also did one for businesses and employees. And then finally, we're doing one for multiple family units. So people who have multiple families in a particular apartment or a house, or families with varying different demographics, like older folks as well as younger folks, to try to get that message across. Radio spots and television have been going full bore since the beginning of the campaign. We are very, very fortunate. Targeting the Spanish-speaking population, as you know, is very, very important, and a big percentage of our population in the county, including Seaside. So we have been blessed to get 2 major Spanish-speaking celebrities to do endorsement campaigns for us. Eduardo Piolín, who is a phenomenon, an award-winning, the first Latinx radio personality to get inducted in the Radio Hall of Fame, and very well known both on radio and television. And then a radio personality, Don Cheto, who is a host of a talent show, and which is similar to America's Got Talent, but from mostly in Mexico. We also have, as Nick said, we've been working very, very closely with a number of industry and community and business organizations to distribute information. And one of the biggest partnerships we embarked on was with the Monterey County Office of Education, thanks to Superintendent Deneen Gus. She was able to get us in contact with all the superintendents of all the schools. We got over about 80,000 bilingual flyers in the hands of parents before school started that went out with the introductory school packets. So we're very grateful to the Monterey County Office of Education, and of course our partnership with the county PIOs, both Maya and Karen, have been phenomenal. We tag team and double team on social media efforts and things of that nature. So I'll cut it off there. If you want access to the Dropbox, if you don't already have it, please just email me and I'll take good care of you.
Thank you, Nick. Is the Dropbox available to pretty much anyone who's on this call to avail themselves of these resources?
Absolutely, be happy to share it with anybody.
That's great. And one of the comments earlier was that maybe some of the Spanish-speaking population was nervous about getting tested. Do you have messages that speak directly to that issue?
Yes, I'm glad you asked that question. We addressed that very early on. As you may remember, we had some radio personalities actually do testimonials about testing and to demystify the testing. And then we also worked on another longer format PSA with Kristy Michie on testing. And we're in the process of reevaluating that messaging on testing because, as you all know, there's been a lot of new information coming down from the federal government and the state government with regard to criteria and testing. So we're going to be refining that message over the next couple of weeks. So thank you for that question.
Thank you. And for those of you who are here, Nick Pasculi did put the link to the Dropbox in the chat, and he has also given his email. So if there are particular PSAs or anything that you want to find on the Dropbox and you're not a good hunter, as I'm not on these kinds of platforms, he can help direct you to what you're interested in. We have run a little bit over time. I want to thank all of the participants and all of the county staff who are here, because there's just so much that we have been learning over time, and this obviously is a pandemic that is continuing to be among us, and so our continued outreach to the community and making available information is absolutely critical. And yes, that was going to be my question. It would be really helpful for us to know how we can better reach the constituents in the city of Seaside to really meet the needs of your people. You know, you are connected to the living and breathing people, and so your knowledge and your sense for what is needed can really help us. We have a lot of good stuff and good intentions. We're doing the best we can figure out, but we could really use your help. So if you have any thoughts right now that you want to put in the chat, or you can email me at my office, jane.parker@co.monterey.ca.us, or of course call the office 883-7570, or use any of the contact information that has been provided in the chat. All of the county staff work for you and want to do the best job for you that's possible. So thanks again to everyone who was here. This has been a really informative discussion. Well, not discussion, presentation, and really look forward to being in touch with all of you in the future to get you the kind of resources that you need to keep yourself and our community safe and healthy. So thanks again. We can stay a little bit longer here if anyone wants to ask questions and interact, but I do want to kind of end it officially for those who do need to get back to your other duties. So thanks again. Yes, question about whether this presentation will be emailed. I think yes, it will be. The link will be emailed to everyone who participated. I think we have your contact information. So thank you, and feel free to distribute it to anyone else and who you think might benefit. Any other thoughts that people want to share, either in the chat or yes, Mayor Oglesby, I think you can unmute yourself and speak.
I think so. No, I just wanted to add my voices to everyone else to say thank you for putting this together and appreciate the team at the county, County Supervisor Parker for bringing them together, and CEO McGee. You guys continue to reach out to the community, and I think this will be helpful. I look forward to accessing some of the information you guys put out, but I know they took time to make this happen, and I know the supervisor's office, it took you guys, you know, a couple calls to put the pressure on them to make time. So I know it wasn't easy, supervisor, so thank you.
Yeah, they're busy folks. The county has been developing, as I say, lots of resources, information, housing options, you know, responding to requests for protective equipment. I mean, it just from soup to nuts. The public health department expanded its lab capacity so that it's doing what, nearly 800 COVID tests, and does a turnaround that is faster than any other lab. It's basically 24 hours. Or less. So, and they started out, I don't know, it was a small number of tests that relatively small number of tests that they used to do in the normal course of events, but have really expanded everything that they're doing. So, and it's true of every county department. They're just really stepping out there and trying to respond to the community needs that we knew of right away and that we learn of along the way. So, and the challenge always, I think, for us is we can come up with things, but we really need the community participation to get the resources to the people who need them, and to also let us know what else might be needed, or if it's needed in a slightly different way. So really appreciate any thoughts that you all have.
Yeah, and Jane, thank you again for organizing this. Thank you, Mayor Oglesby, for joining us. I think we also had, you know, Mayor Kerr and Mayor Carbone on as well. And, you know, we'll follow up with everyone, but the county does have quite a bit of information and resources. The contract with TMD has been phenomenal in terms of providing additional collateral material for sharing on social media and, you know, out into community groups. So we just want to make sure that everyone in Seaside has access, that we're spreading that resource as widely as possible. So we will circle back, make sure everyone has what they need. And if there are questions, if questions come up, contact Jane, contact the office. We will make sure we get you in touch with the right county staff people. And if there's interest in having an ongoing communication with TMD about specific needs that the city has, let us know. We can make sure that we follow up on that as well. But, you know, communication with the public has really been one of the biggest challenges that we've had, and making sure that people have the information that they need to stay safe. Seaside really does, you know, we've got the highest numbers, but Seaside is providing the workforce for the rest of the peninsula. So, you know, making sure that we're keeping our workforce safe is a primary goal that the county has, and we can only do that working in partnership. So just want to thank everyone again for your time. Thank you for all of the conversations that you've had leading up to this conversation today. And we stand available and ready to be supportive and access and leverage as many county resources as we can to serve the city.
And by the way, before we sign off completely, for those of you who are still here and who used to call the office, and the voice at the end of the phone was Lori Chappell. She has moved along to another job, and now the dulcet tones that you will hear when you call the office are of Jenny McAdams. She's here on this call and has really stepped in to the office manager position and in a phenomenal and very, very effective way. So thank you, Jenny, welcome. And now you're officially introduced to at least this group. So thanks again, everyone. Let's see, question in the chat. Is there an option for workplace testing where our essential workers are versus them going to testing sites? Good question. Dr. Moreno, can you?
Yeah, so there's a few groups that we've looked at this. One group is the ag worker group. Another work is the healthcare worker group, and I'll just share some examples. And with the healthcare worker group, we have worked with at least one hospital to bring specimen collection to skilled nursing facilities that were had cases and were dealing with a potential outbreak. And so we have done that in the past, working with the hospitals with their nurses to come in and assist with that. So another example, I think, is the ag worker population. And I think the Clinic of the Salud has actually been taking specimen collection services out into the work sites to try to encourage farm workers to submit specimens for testing. So there are challenges. Otherwise, I think we would be doing more of this, but there are challenges in terms of having the workforce to actually go out and collect specimens and then submitting them and getting test results back in a timely manner. But yes, I'm glad some brought that up. We have explored that. We've worked with partners to try to get that done on more of a case-by-case basis.
Thank you. And one of the issues that comes up whenever we talk about schools going back into in-person teaching environments is the part of the requirement from the state and local officials is that there be a systematic testing of the staff. And I don't remember about families and children, but there's going to be an increased need for testing as that starts to happen. So that whole question of the capacity and how conveniently people can get tested, but then also how quickly the results can get back so that people know what to do as a result. It's a real challenge to the system, but I think we have more capacity than we did. And I don't know, Dr. Moreno, if you have a comment about that you'd like to make.
Sure. I would just add, Supervisor, that the California Department of Public Health continues to approve more and more laboratories to run the COVID-19 test for California residents. So we have increased lab capacity, and the turnaround times have improved. I think part of that is because the labs are increasing their capacity, the number of tests they can run, and staffing up to run the test. But also there's also a decrease in testing rates statewide. So as the lab capacity increases and the number of labs, which increases access, increases, testing has dropped a little bit. So those that really do need to be tested are going to have there'll be a quicker turnaround time. So I think there are some more options that the schools have now that they probably weren't aware or didn't have back in, I guess it was May, June, when they were thinking that a lot of schools, not just Monterey County schools, but a lot of schools in California were thinking they're going to resume in person, and they had concerns. But you're absolutely right, Supervisor Parker. That's one thing that the state recommends in order to identify school staff who are positive and infectious and get them out of the school setting before they infect other people.
Thank you. All right, I'm going to need to sign off and go to my next thing. So again, I just want to thank everyone for your participation, and to the community members who are really helping us at the county do our job even more effectively. So thanks again. Take care. Be safe. Be kind.